Salina Medical Outreach, also known as SMO, is a student-run organization at the University of Kansas School of Medicine. Since its creation in 2018, the purpose of this group has been simple but ambitious: to make a meaningful impact through service, both locally and internationally, while students are still in training. SMO exists because healthcare doesn't begin and end in a clinic. It lives in communities, schools, public spaces, and relationships. From the beginning, the mission has focused on showing up consistently, learning alongside others, and serving people regardless of status, background, or circumstance. Our members are all medical students, but our outreach includes both medical and non-medical efforts. The goal isn't just to provide services. It's to learn how to engage responsibly with communities, to understand barriers to care, and to develop empathy that lasts well beyond the medical school. Everything SMO does is grounded in equity, collaboration, and respect for the people and organizations we serve.
Locally, SMO organizes and participates in a wide range of outreach efforts throughout Salina. These include public health screening booths, participation in ComCare's annual flu shot clinics, health education modules for Salina high school students, supporting the Morrison House, and involvement in seasonal community events. While the settings may change, the purpose remains consistent: meeting people where they are, supporting existing community efforts, and contributing in ways that are reliable and sustainable. A key part of SMO's local mission is education and prevention. All of our endeavors focus on improving access to information and early care, while also providing students and community members experiences and resources that will help improve their lives. These experiences reinforce that healthcare is not only reactive, it's proactive, preventative, and deeply connected to public trust.
Clinical-based outreach provides an important perspective on patient-centered care. Even brief interactions can highlight how access, communication, and trust influence health outcomes. These experiences emphasize that effective care depends not only on medical knowledge, but on listening, respect, and partnership, especially when working with underserved populations. These experiences changed how I think about patient partnership. You want to make a big difference in one visit, but sometimes the most important part is building trust so the patient feels comfortable coming back. Medicine isn't just about medication and moving on. It's about rapport, connection, and understanding how life outside the clinic affects health. That's why I love Saturday Clinic and why patient-centered care matters so much to me.
SMO also supports the community through services at public events such as local races, Salina Liberty Games, and other functions. These settings may not look like traditional healthcare spaces, but they can carry real responsibility. Being present, attentive, and prepared matters, even when the goal is prevention. Working alongside volunteers from different backgrounds reinforces teamwork, humility, and awareness, all of which are essential skills in medicine.
Service experiences through SMO often influence how students approach other areas of training. Lessons from outreach can shape communication, leadership, and collaboration in classrooms and group settings. Over time, consistent service helps reinforce habits that carry forward thoughtfulness, accountability, and a broader understanding of responsibility.
For many students, SMO offers an early opportunity to engage with the community in a meaningful way. These experiences expose students to perspectives that aren't always present in a formal coursework. SMO creates space to learn through service and curiosity, acknowledging that growth often comes from uncertainty rather than having immediate answers. Coming from Virginia, SMO has helped me engage with the community and feel welcome here.
I think that SMO emphasizes that becoming a physician involves more than just developing the clinical skills that we use in the hospital, but the early service experiences help reinforce behaviors that are more necessary for those clinical environments, like listening carefully, recognizing barriers, and understanding the context and meeting patients where they're at. Engaging with the community before becoming an attending physician encourages growth and a stronger connection with the people in your community, your state, your town, and the people that you serve.
SMO equips us to be better physicians by developing servant leadership, cultural humility, and real-world clinical compassion through high school mentorship, community health outreach, and mission trips. By serving our own home community and other underserved areas around the world, we learn to practice medicine with empathy, teamwork, and commitment to holistic care beyond the clinic.
Medical training can be demanding and, at times, isolating. SMO helps foster a sense of belonging by creating shared responsibility to each other and to the community. Showing up consistently builds accountability and reinforces that service is not a one-time effort, but an ongoing commitment. Being part of this group has made me realize that I'm not alone. Others are going through similar challenges and navigating the same experiences, which makes me feel more understood and supported.
As SMO looks ahead, remaining actively involved in the Salina community remains a priority. Growth is approached intentionally by deepening partnerships, responding to real needs, and aligning new initiatives with the organization's mission. The goal is not expansion for its own sake, but sustained, meaningful engagement. One way we plan to do this is through a new initiative with the Salina Library to help with story time and donating books to the library.
Many of SMO's initiatives begin by identifying gaps in access or resources within our community. Learning how to seek out unmet needs and collaborate with other local organizations allows us to turn concern into meaningful action. One of our newest initiatives is a partnership with the Period Project, prompted by a clear community need for improved access to menstrual products. Over the next semester, we will focus on advancing menstrual equity through donation drives and menstrual health education as part of our broader mission to reduce barriers to basic health needs. A key goal for SMO this year is strengthening collaboration with local projects in the Salina community, as we believe this approach multiplies impact and fosters lasting change.
International outreach is another important part of SMO's mission. To date, the organization has sent students on 5 international medical educational trips, including recent trips to Lima, Peru. At Centro and Sullivan del Peru, students learn from a community-driven model focused on education, inclusion, and dignity for individuals with different abilities and special medical needs. These experiences allow students to observe different healthcare systems and cultural approaches to care. Learning from international partners helps clarify universal principles, respect, collaboration, and equity that apply both abroad and at home. While at CASP, we were given the opportunity to tour the school and observe many of the teachers with their students, and saw that they themselves intentionally prioritize these values of respect and collaboration in their teaching and training.
One of the moments that stood out to me in Peru was during a Stop the Bleed training with the CASP staff, parents, and students. Everyone was really engaged, asking questions and wanting to be prepared. Seeing how invested they were reminded me that our work actually has an impact. It really makes you pause and remember why you chose to pass in the first place.
Our work is made possible through community support. Donations and fundraising directly funds supplies and resources for local outreach, medical education trips and logistics abroad, and ongoing health education programs. Continued support allows KU SMO to collaborate with underserved communities and sustain meaningful service. Salina Medical Outreach was created to remind us that service is foundational to medicine. At Centro and Sullivan del Peru, we learned the phrase, "Juntos hacemos posible lo imposible." Together, we make the impossible possible. Whether serving locally or internationally, KU SMO is committed to education and service, and we invite others to join us in supporting community health and well-being, because after all,
Juntos hacemos posible lo imposible.